Nagaland has seen a massive surge in dengue cases lately. And here in Dimapur, the commercial hub, the highest populated town of Nagaland and the district, highest populated district, has seen the highest rate of dengue cases. Here right now we are here at Zion Hospital where the management spoke to us and they have said that yes, they are overwhelmed right now with patients and they are burdened with the number of patients coming in, but at the same time the patients are also recovering and going out. So there is a waiting list. So as soon as a patient gets released, discharged, they are admitting again more for dengue cases. And we have also spoken to the medical superintendent of CIHSR, or popularly known as referral hospital, and he has also said that there has been a 30 to 35% surge this year, and this could be the highest ever, especially in recent times, of dengue cases. And we have also spoken about the problems faced of blood donation and the blood transfusion, the need for platelets especially, and how the blood banks such as the blood bank at referral hospital as well as civil hospital, they are exhausted, and they have also informed us that yes, they have been exhausted. And there has been also word from officials that doctors also should not be too irrational in issuing a patient to bring blood for blood transfusion, and there should be a rational use of blood right now, because not many patients are admitted. Those dengue patients are admitted, and only severe cases they are admitting right now. Let's have a look at the report. I am sitting here with Dr. Timjan Longkumar of Olive Hospital. He's a pediatrician over here, and we also would like to know about what is the scene or the scenario at Olive Hospital from him. Dr. Timjan, thank you for speaking to us. Doctor, can you just tell us also now, how is the scene at Olive Hospital, and in regard to dengue cases, is it every day that we're seeing cases over here at the Olive Hospital?
Yes, even here in our hospitals are full of dengue patients. Almost, I should say, more than 90% of the patients are dengue, and then we don't have rooms to admit. And yes, there is anxiety and distress even among the doctors and the staffs also, because we are overwhelmed with the number of patients, and then it's difficult to handle for us also. So one thing I would like to say is that not all dengue patients need not to be admitted. So we need not unnecessarily create tension just because that it's dengue positive, because 80% of the dengue patients will recover with some symptoms. Yes, fever might be there, but there might be some rashes, vomiting, headache, joint pain, but most of them will recover. So only few, around 10 to 20% will lead into complication. So those are the patients we need to look after. So when there's a panic situation, then it creates a scenario where the required patients don't get appropriate treatment. So we should not create a panic also. That is one thing.
Doctor, you're a pediatrician over here, and you are dealing with children and kids and all. How many dengue cases have you seen in them, and how many do you think are admitted, or how many are admitted here in kids also? Because we seem to see mostly adults, hearing of adults needing blood and everything, but what about children?
Yes, children are not immune to dengue, so they are bitten by mosquitoes. Yeah, so I have lots of patients with dengue. In fact, recently I had one rare case of dengue encephalopathy, means affecting the brain. And then also a case of dermatitis with whole body skin lesion. So some rare cases are also there, and especially this year the number of dengue cases is quite dramatically increased. So even children we do have, and even less than 1 year also we do have, in infants also we have dengue cases.
Doctor, in regard to the blood banks and all, I've also heard, I just mentioned to our viewers that we have two blood banks in Dimapur, which is the civil hospital, the district hospital, and as well as referral hospital. So according to sources, these two hospitals have been exhausted of blood, and they have also informed Nagaland News Network that there has to be rational use of the blood, especially in terms of platelets, because we have the count of platelets, and people tend to panic if it's 20,000, but then people with even 10,000, they don't need that sometimes. So, doctor, can you just tell us also, in Olive Hospital, where do you send your patients, and what is the scenario when it comes to getting the blood?
So there are a few things related to this blood. So like she already said, all patient doesn't need blood transfusion. And then platelets is like for 1 unit of platelets to be made, we need at least 5 blood bags. So one reason that the blood bank doesn't have platelets is because we are very poor donor, and then blood saves lives. So we should be active and we should donate blood. It won't harm anyone. In fact, our blood is being replaced every day. So within few hours, the blood which you have donated the volume will be replaced within few hours. So we need not worry and panic also. And the other thing is, blood to open a blood bank, the regulation is very strong and very complicated and difficult. And that's why one reason is that there are not many blood banks, and so they themselves are also overwhelmed, and that is also one reason. And the other reason is like platelets is something which stays in the blood only for 7 days. So every 7 days the platelets are being replenished by the body. So even if you give platelets, we are assuming that it will hold the decrease in platelets, but it doesn't happen so in many cases. So the body itself has a capacity to regenerate the platelets. So we need not panic also. And it is not only the platelets which prevents bleeding. There are many other clotting factors which prevents the bleeding also. So just because your platelet is low doesn't mean that you will bleed to death. So if the other counts are okay, then there's less likely. Some people even they tend to bleed. Some with even 20 to 10,000 or 10 to 20,000 of platelets, they don't have any symptoms of bleeding. So yeah, unnecessary. We should not create panic. That is one thing.
Doctor, in Olive Hospital, how is the manpower also now that we are exhausted of our rooms, the blood, and generally the service also, because we are attending, hospitals are attending to many patients. Now, how is it in Olive Hospital? How is the manpower? And Nagaland now, do you think, in your opinion, needs a whole revamp of the medical scenario?
Yes. Actually, the thing is that we, as a state, also should have a protocol of managing. Like we never know when the next pandemic or the next thing will happen. Now it's dengue. Next thing might be scrub typhus, which is also very prevalent is there. So if we have a concrete policy of how to tackle when these things happen, then that will reduce the burden also. And there should be a proper coordination between the government hospitals and the private hospitals. So there is many times there's distrust, and then a logistic problem also is there. So all these things need to be taken care. So medical care is not just about treating the patient, but again, administrative and all those are also involved. Those are also very much part of the medical care. So I think that should be taken care.
We have here Dr. Clement. He is the medical superintendent of Referral Hospital, or also known as CIHSR. And this hospital not only gets patients from Nagaland, but across the border as well from Assam. And right now, as we have also said, that there's a huge, massive surge in dengue cases in the commercial hub as well as all across the country. So, Doctor, can you just tell us what is the scenario like at Referral Hospital? Is the hospital overwhelmed right now or burdened right now as such?
Um, yes, patients are reporting with fever, and when we evaluate them, many of them, when they are tested, they are testing for positive for dengue, and There is a surge of around 30 to 35% in inpatient admission, and also in the casualty we have almost seen double rise in the number of patients that are reporting in the emergency. Even in the OPD, we are seeing rise in the number of people who are coming with history of fever, and many of them are turning positive for dengue. Yes.
So, what is the admit level percentage of patients with dengue? So, since not all patients with dengue positive for dengue needs to be admitted, so on an average at referral hospital, what is the number?
Yes. Yeah, many those who are tested positive in the OPD or in the emergency, we don't admit everybody. Basically, we are trying to see their platelet counts, and if they are found to be at a level which is though below normal but still on the higher side, then we are advising them to be at home and continue to be taking good nutrition and regularly testing their blood. And the signs that they should get admitted, we make it clear to the patient that platelet comes, if it comes below around 25 to 20,000, that is the time they should get admitted. Or at any point of time, if they have any bleeding from any part of the body, then we are advising them to get admitted. Yes.
And regarding the blood bank here, like I said earlier, reminding our viewers that we have two blood banks in Dimapur, that is the civil hospital and over here the referral hospital. So, sir, how is the situation at the blood bank considering that the surge has gone up, like you said, 35%? So, what is the scenario and the situation at the blood bank at referral hospital?
Yes. Yeah, the need for platelet for patients who are suffering from dengue has been comparatively much more than previous years. And fortunately, we have blood bank in our hospital too. The thing about platelet transfusion is from one donor, you can make one bag of platelet around 30, 40 ml. And platelet are very sensitive component of the blood, which can be stored only 5 days in the blood bank. Beyond that, we cannot store. So I think we cannot store too much in the blood bank from all the donations that happen. But again, when there is a sudden surge, to find donors, it's a challenge. So that is the challenge we are facing right now, because now the demand is more. So at this point of time, voluntary donors will make a lot of difference for many patients, because patient who has active bleeding and whose platelet counts are less than 10,000, they will need at least 4 to 5 bags of platelets, and for which they will need as many donors. So that's why blood donation is very crucial at this point. And sometimes, again, the blood group, though you can transfuse platelet from any blood group donor, but many people prefer that same blood group donation, platelet of the same blood group are transfused. So those issues are there. So rare blood group platelets are difficult to get in this situation. So I think voluntarily, if people comes for donation, that will be of great help to the people who are suffering.
Do you think think the public is aware, or is there a need for awareness for blood donation? We have these camps, blood donation camps, time and again across the commercial hub. But do you think the whole public is aware that this is good not just for the patient but also for themselves? So do you think that we need to educate on this more?
Yes, I think even on regular donations, the people who really voluntarily come up for donation is comparatively less. From that point, I should say that awareness level might be less, or maybe there might be some hindrances which doesn't make them come forward. So definitely a lot more awareness about benefits of blood donation, and especially in times of crisis like this, it will be of great service to the people who are suffering. So that's why I think in general public also, if they respond to the need, I think that will really help the people who are in need. Yes.
Doctor, one last question. Like you said, that yes, the hospital is a little overwhelmed. So how is the hospital managing the inflow of patients right now because of the surge of dengue? How are you managing, and what are the top priorities right now as a hospital?
Yes. Yes, all our ICUs and general ward and even private ward, most of the time it is completely occupied. And every day the number of discharges happen, same amount of admissions seeking patients are coming in. And there has been time where we had to refuse some patients because they were quite serious and we didn't have, we could not provide ICU beds. Those were very unfortunate. But our staff have been working very hard, and also, even though they themselves were, and because dengue affects everybody, many of our staff also had to face that, but they have given their best, even though some of them were sick for some time. And so we have tried to accommodate as many patients as possible, as far as possible. Yeah.
So as the doctors, the Dr. Tamjan of Olive Hospital and also the medical superintendent, Dr. Clement of Referral Hospital, mentioned that yes, most hospitals right now, they are full. There's no beds or cabins left, but then every day there is an exchange happening of where people are getting discharged, patients of dengue are getting discharged as well as getting admitted at the same time. Now dengue cases have risen drastically in recent times, 30 to 35%, and right now there is a big need for blood donation from volunteers especially, and there needs to be awareness that blood is the need of the hour right now because all the blood banks, especially the one at Civil Hospital and Referral Hospital, which is the only two blood banks in Dimapur town, the biggest populated district of Nagaland. There are only two blood banks, and these blood banks are exhausted at the moment. Esther here with camera person Moa for Nagaland News Network.